Hi, I would like to greet everyone. Today is April 24th, 25th, 2022. The topic of today will be who needs hospice and palliative care. This is a very important topic in healthcare because sometimes the loved one they feel guilty um, to um, to request hospice and palliative care for their loved one or for themselves. I'm going to give you some education. Is it time for hospice and palliative care? Again, my name is Yanick Dantiste. I am a family nurse practitioner based in West Palm Beach, Florida. Well, as you know, nurse practitioner, we do really holistic medicine. Physical, body, mind, and spirit. So before I give before I give some education, some teaching about health, I would like to go to God's words to see what God said about sickness. So um, today we're going to go to James 5, verses 13, 14, and 15 to see the spiritual component of sickness. James 5, 13 through, let's do 13 through 16, stated like this. Quote, is anyone among you suffering? Let him pray. Is anyone cheerful? Let him sing psalms. Verse 14, is anyone among you sick? Let him call for the elders of the church and let them pray over him, anointing him with oil in the name of the Lord. And the prayer of faith will save the sick, and the Lord will raise him up. And if he has committed sin, he will be forgiven. Confess your trespasses to one another and pray for one another that you may be healed. So this is the spiritual component of sickness. I have that habit. Before I see my patient, I pray before, because sometimes I discover things. It's only God, who guide me to discover some symptom, to discover some you know something that I could have missed. So that's why the spiritual component is very important for me. Now let's so who needs hospice and palliative care? So what is hospice and palliative care? Okay, so hospice is palliative care for patients with a prognosis of 6 months or less, and is appropriate when goals are to avoid hospitalization and maximize time at home for patients who are dying. So sometimes the patient or the loved one, they said, okay, you know what, that's enough. I don't want no more suffering. I want my loved one to stay at home. Or the patient itself can choose that. They said, you know what, I don't want no more poking. I don't want no more testing. I just want to be comfortable. And they request you hospice care. Also, sometimes the primary care physician or nurse practitioner or physician assistant or the oncologist can advise the loved one or the patient himself, you know what, this is the time you need to think about another option. So palliative medicine is specialized medical care for people with serious illness. Serious illness is one with high risk of mortality that negatively affect quality of life or function, or is burdensome in symptom, treatment, or caregiver stress. Palliative care improves symptom management and addresses the need of patient and family, resulting in improved patient and caregiver quality of life and reduce symptom burden and healthcare utilization. So, so both hospice and palliative care, they both offer relief from the pain and symptom of a serious illness. And also, hospice and palliative care address the emotional, social, and spiritual needs of patients and their loved one, their families. Also, we have to remember hospice is a type of palliative care for end stage of life. So someone can be palliative care, but you're not hospice. So, in the medical field, the treatment gives two options. Either the treatment gives to curative to cure the illnesses or diseases, or to palliative, the disease. So that's what that means. So if someone has a disease, got sick, and the doctor said, they cannot cure it, so most likely they will give that person that option to go to palliative care. But it's not necessarily mean that that patient is hospice care. So remember, hospice is a palliative care for patient with a prognosis of 6 months or less. So that's why they said, but now I see patient, they are hospice for a year, 2 years. So it's not necessarily 6 months or less, but this is the definition of hospice care. So hospice and palliative team. So in hospice palliative team, you have physician, you have nurse, you have social worker, you have chaplain, you have music therapist, you have massage therapist, and also I heard that now Medicare, they approve patient can have physical therapist as well. So again, hospice and hospice the care can be delivered at home or in the hospital. We have, and also, the objective for hospice and palliative care. What is their objective? The objective is hospice palliative care is to facilitate comfortable and natural death. So the same way, when women, they are pregnant, you have the team, the obstetrician. We have the nurse who is specialized in OBGYN. They are there to welcome the baby. So in the contrast, when you're getting old and you have a terminal disease or chronic disease, so there's a group of people, which is the hospice and palliative care people. They are there who can facilitate the dying process. So the team, again, you can, physician is there, nurses, social workers, chaplain, music therapy, massage therapists, and also now they add physical therapists. So we have there is a questionnaire for hospice and palliative care, so people can answer, or the loved one, or the person, and the patient himself or herself can answer to see if really is it the time for hospice and palliative care. So if you answer those questions by yes, that's meaning this is the time. For example, if you answer that yes to did your loved one or you has been hospitalized or gone to emergency room several times, in past 6 months? If the answer is yes, so that it can be appropriate for that person to be enrolled to hospice and palliative care. Also, question can be, did that patient started taking medication to decrease physical pain? So at the end, especially if you have cancer or sometimes AIDS, HIV, patient can have at the end, the patient, that person can have pain, like chronic pain. So if that person is starting taking medication and the pain is so big now, is so intense, so maybe it's the time to think about hospice and palliative care. And another question can be, did you notice your loved one or yourself have a shortness of breath even while resting? Okay, let's say you or your loved one has end-stage congestive heart failure. If you have that, at the end, you're going to have breathing issues. Even though you lay down, you're going to have hard time to breathe. You're going to be on oxygen. So if the answer is yes, so this is a time you may consider hospice and palliative care. And also, one of the questions can be if you've been told by a healthcare provider that your life expectancy is limited. So if they tell you, you know what, according to what you have, your life expectancy now could be less than 6 months. So this is time this is the best time you can think of hospice and palliative care. For and again, the objective of that is again to have a peaceful death, a natural, comfortable death. So they have more questions. So they ask. So I just go over 4, but there's more. There's many more. So someone can say, okay, what are those serious or terminal illnesses? So there's serious diseases can be advanced cancer, like stage 4 cancer. So when you have advanced cancer, that's meaning the cancer has spread into other part of your body of your body. So the only way they can know that is by doing a PET scan. If they do a PET scan, okay, so they will know if the cancer has spread. So I mean, if you have a cancer stage 4, that's meaning it's spreading. You already have metastasized, so that's what that's mean. Serious illness can be end stage of congestive heart failure, end stage of COPD. This is chronic obstructive pulmonary disease, and end stage of dementia, end stage of Parkinson disease, Alzheimer. All those serious illnesses at the end, the terminal stage. This is this is the right time for the loved one and the patient to think about hospice. So they have to consult their physician or their primary care provider, of course, to discuss that. There's different name of hospice entities in South Florida, where I live. We can have Vitas Hospice, then we can have Trustbridge or Hospice by the Sea or Treasure Coast Hospice. So there's different ones. So you can Google them, you get their phone number, and also, by the way, anyone can refer a patient to hospice. Okay, anyone, can be yourself. I mean, let's say if you have a terminal disease, you live by yourself. You can refer yourself. You can, take the phone, get their phone number. You call them, say, listen, I have that terminal disease. I'm suffering. I don't want no more aggressive treatment, no more poking, no more testing. I just want to be comfortable. So you can call themselves, or your loved one can call, or if you are in the hospital, the people in the hospital, like social worker, the nurses, they can call for hospice and palliative care to come and assess you, and the assessment is free, by the way. Finally, hospice is covered. Hospice care in palliative care is covered 100% by Medicare for all eligible patients. So what they mean by that, when they said for all eligible patients, they mean patient who has serious illnesses like advanced cancer, stage 4 cancer, and stage CHF, COPD, dementia, Parkinson, and Alzheimer's. So this is what really you need to know. Maybe the patient, her and himself, or the loved one, is it time for hospice and palliative care? So there's criteria. So you can visit to see if it's the time. But in general, your healthcare provider will guide you. If you call them, they will guide you. Because I have my patient, as a matter of fact, last week, I have a patient that I already spoke to his daughter about hospice and palliative care, and everything was fine. She understood, everything was fine. And she called me last week to ask me the same question. But you know what? That's fear. That's fear. That's, that daughter needs more education, or sometimes they don't feel like comfortable, to put their loved one in hospice care, and it's fine. So just call. If you don't feel comfortable, you need more more information. You can call your nurse, call your healthcare provider, and they will guide you. So that's it for hospice and palliative care. Yeah, so that's it. So again, so remember that the overall goals of treatment is to optimize the quality of life, like hope and desire of patient are fulfilled. Okay, death is regarded as natural process to be neither hastened nor prolonged. So on that, I will stop, and hopefully that information has helped you, to distinguish if it's time for your loved one or yourself to go to be enrolled to hospice and palliative care. On that, I will leave you and wishing you the best of health. Bye-bye.